Hello everyone, I am Dr. Ameet Oswal, consultant interventional cardiologist, Bangalore. Today we will discuss on how to treat calcified coronary arteries. So you might have come across when you go for an angiography and your doctor detects that you have blockages, and some of these blockages are quite hard. They are like stone because over the years the blockages which are soft plaques become hard and thus the calcium get deposited. And these are the blockages which are very critical and very difficult to manage with a usual angioplasty. So we have in the practice we use rotablation or intravascular lithotripsy as a procedure to treat these calcified blockages, and these are cutting edge tools and treatment aspects which are available in the interventional cardiology field. Now the 2 out of 2, the rotablation is a complex procedure, and of course it carries a minimal risk when we are doing the procedure, and these procedures are done same way as we do the angioplasties. The same, we pass the tubes through the leg, arteries of the leg or arteries of the hand, and once we reach the area where the block is, we drill through it through the rotablation to clear the hard blocks and thus treat those blockages and help us to put a stent in an easier way and get the best results at the end. So what is rotablation? Rotablation is a wire with a diamond tipped drill-like structure which basically rotates at a speed of 1,70,000 to 1,80,000 rpm within fraction of seconds, and thus cuts those hard calcium blocks into small minor particles and thus clears the block, and then the stent is placed so that the block does not recur. The same way, intravascular lithotripsy does not do a drilling work. Is basically a balloon which is kept across the block, and then a shockwave lithotripsy, basically shockwave energies are passed through it and which cracks open the calcium and thus clears the block and helps put a stent easily through the blocks. Now both this procedure seems to be very complex. Yes, they are complex procedures, but the results are quite good, and in hands of experienced cardiologists this procedure can be easily done. So the complications related to this procedure can be minimal and has to be discussed with your interventional cardiologist before you proceed further. Thank you.